is Michael Weiss. I'm a student nurse, and I'm going to be demonstrating just the administration portion of a minibag medication, secondary line. This medication is Zithromax, and it is being prepared for us by pharmacy. So just before we enter the patient's room, we're going to review the drug monograph, and I see here that a student nurse can give it, so that is good. And I just want to double check the max single dose is 500 milligrams, and we're giving 400 milligrams, so we're within that, and the max daily dose is 500 milligrams, so we're also within the daily dose. I did my calculations just to verify that we're giving the appropriate dose, and everything is appropriate here. We're giving it a 250 milliliter mini bag of normal saline, and we have a final concentration here of 1.6 milligrams per milliliter, and we will be running it at a rate of 254 milliliters per hour, as stated in the drug monograph. It says to administer over 1 hour, so we have no choice but to administer over 1 hour. So upon entering the patient's room, I will perform a safety check, making sure that the patient is not in any distress, and then I will verify my patient's identity after introducing myself. Of course, I always perform hand hygiene. So, hello, my name is Michael. I'm a student nurse. Can I just get you to provide me with your name? Good. Vanicio Vince. And your age? Or date of birth? Good. August 1st, 1963. That's good. And do you have any allergies? No, you don't? Okay. At the same time, I'm assessing the IV site, looking for any redness or swelling or pain on palpation, asking the patient, and the patient doesn't feel any pain, and I don't see any visible abnormalities. And the pump is infusing at the appropriate rate. The primary is infusing at the appropriate rate, so I'm confident that it's infusing okay. So I will then proceed to complete my third check. So we have identified the patient. Now, Zithromax, we're doing red drug, 400 milligrams, and we're going to be giving it IV and daily. So the time to give it is now, since nobody else has given it. And the time is 12:06, so we're doing this at 12:06. What I can do now is begin to set up my lines. So I want to start by dropping my primary. And then I will proceed to spike my mini bag, making sure not to touch the spike to anything to maintain sterility. And then I will make sure that my clamp is shut so that I don't contaminate it. My mini bag. And then I'm making sure to attach it to the port behind the Baxter pump, so that the Baxter pump is able to regulate the flow of the secondary. I'm cleaning for 30 seconds and letting dry for 15. This one had a sterile cap, so no need to clean it. So now that that's all connected, I'm going to back prime to ensure that there is no air bubbles in the line, and back priming also ensures that there is no medication wasted when priming. So all the air is out of the line, and the chamber has filled up about halfway full, enough room so that I can see. Additionally, when I got this bag from pharmacy, I checked it for the expiry date, of course, and if there was any precipitants in the bag or discoloration, and there was not, so that is good. So now that we're back primed, I can go ahead and set my rate. Additionally, I would have a label, and I would label this line so that any other subsequent nurses know when this line was hung. So I'm going to go to my secondary, and I will set the rate at 204 milliliters, and then I will set the volume at 254 milliliters for both of them, because we have 254 milliliters in the bag, and it's to be run over 1 hour, so 254 milliliters per hour. So then I will confirm my secondary, and I will start my secondary, and making sure that all my clamps are open, which they were not, so I'll just open up my secondary, making sure all the clamps are open, and I'm watching it for 3 drips at least, and this is a very fast rate, so I can see many drips going on. I'm just gonna stop that. So that was running appropriately. I would make sure that the patient is okay. Of course, when I explained to the patient, I let them know they had the right to refuse, and they did not refuse. Now that I've hung it, I will document the time. So I gave it at 12:10, and of course date and initial. I will document any adverse effects that the patient might have had, any complaints. I will document what I gave and how I gave it. And before I left the patient's room, I would do a safety check, ensuring their call bell was within reach and their appropriate rails are up and the bed is down. I would also let the patient know that if they felt any dizziness or headaches, or if they have any diarrhea, that to let me know, and I let them know that the antibiotic was for their pneumonia infection, and call bell within reach, and yeah, that's it.
Perfect.